There's a video that's been going on around TikTok talking about students doing vaginal exams or cervical exams on patients under anesthesia, and how that there are not laws in many states that prohibit this. And there was concern that this could be done on someone going in for a procedure that had nothing to do with women's health, say a tonsillectomy, and not giving consent, and medical students learning how to do a pelvic exam on someone that was anesthetized.
I'm going to put a huge trigger warning on this one, because when I found this out, it really, really upset me. I don't even know how it first came up. I was going in to have surgery, and someone warned me to make sure that they understood I did not want a pelvic exam while I was under anesthesia. And I was like, what? So, did a little research. There are only a few states where it is illegal to perform a pelvic exam on an anesthetized person. And that means that it is possible that if you went into surgery for something, sometimes as simple as a tonsillectomy, that students, interns were allowed to practice pelvic exams on you while you were asleep. Until now, there has been no informed consent for this practice. A lot of medical students started speaking up, feeling like they were violating patients, and that is how it came to light. Google it. Still happening. Not okay.
So let me walk you back. I don't think you were born. This is mid-1980s.
Okay, probably
You were not born.
No.
I was in medical school in Columbus, Ohio State. And I remember the beginning of our third year, when our clinical rotation started, they used model.
Right.
So there was a paid female patient who was behind the curtain, and many of us lined up behind that curtain, and one by one, we went in and did pelvic exam.
Oh, wow.
That's how we started.
Right.
And I, of course, felt very awkward, like all of us did,
Yeah.
because it's just the whole process.
Yeah.
It's about learning.
Right.
And I remember the patient was very calm and engaging, and
Yeah.
here I am, nervous medical student in my 20s, and just don't know what to say.
Yeah.
Fast forward to my residency time, 1990 to 94. It is true, we did not ask for consent during procedures. For example, a major surgery, let's say hysterectomy, I think Dr. Hamid, one of my favorite surgeons, consented the patient. I'm not sure if he asked the patient, by the way, I'll be assisted by a resident and a medical student. So that's 1990 to 94. Next 20 years, I had students, residents, and whatnot. I don't think we asked the patient. Fast forward where we are right now at Winchester Hospital.
Yeah.
What happens is, if I'm doing a procedure, then in the consent form, I'm listed as a surgeon, and also listed are anyone who may be participating.
Right.
Medical student, resident, and also ask patients permission to say, can he or she be in the room participating to this degree?
Right.
Some say yes, some say no, but that all has to be documented.
Right.
Now, we're talking about Boston, Mecca of medicine. Perhaps we are ahead of some, perhaps not, but that's where we are right now.
Right.
And unfortunately, it sounds like in this young lady's case, wherever she is, that did not take place.
Right. Yeah. And it sounds like it happens in other places, but it's nice to see that the progression over the years, that things have gotten a lot better.
You know, take simple pelvic exam. Pelvic exam, it's straightforward, perhaps. So if we explain the pelvic exam, let's talk about PEP test. Usually the patient is lying on a back with their legs open. And first of all, every provider, male provider, needs to have a female chaperone.
Right.
That exam should never be done. So 30-some years I've been doing this. I never, ever did an exam without a female chaperone.
Right.
If I don't have one, I cancel the appointment.
Right.
It just isn't done. Some lawyers or legal mind will also say even female providers should have a chaperone.
Right.
And I think in many cases they don't, but it is recommended.
Right.
So we do external examination of the genitalia. We insert speculum, usually plastic. Some still use metal. We visualize the vaginal wall, the cervix, and then we do a little scraping on the outside as well as inside of the cervix or endocervix to obtain a Pap test. If it is a test for an infection, just inside the cervical opening. We remove the speculum and then we use 2 fingers in the vagina with one hand, and with the other, we palpate the abdomen, try to feel the size of the uterus, which way it's pointing, and then we also examine the side, the fallopian tubes and ovaries, and try to figure out, is everything normal?
Right.
At any time I feel something enlarged or cannot feel, then we do an ultrasound.
Right.
And you know what's going on with America lately compared to 30 years ago. People are bigger.
Right. Probably
So-
harder to feel.
Harder to feel.
Yeah.
There are many patients, I don't know what I'm feeling because
Right.
it's hard because of the girth,
Yeah.
the abdominal wall. And I bring that up because, you know, the one of the entities had said, oh, women don't need pelvic exam annually by their primary care.
Right.
I don't know. I mean, I think I would have my wife have her pelvic exam done by a primary care if I knew that primary care physician was qualified.
Right.
I'm not sure if that's the case with every primary care.
Yeah, it's interesting because before I got to the age where I was pregnant, my primary care had always done my pelvic exams. I'd never went to a gynecologist until I became pregnant.
And the point I make is I just think some cases, some diagnoses may be missed
Right.
because pelvic exam is not that straightforward.
Right.
Especially because of anatomy. Now, this young lady had done, I don't know what surgery she had done, but
Yeah.
you know, the story is that she was told by a resident that she was menstruating because the resident had done an exam. Is that how she found out that she had a pelvic exam done, right?
I'm not sure. I didn't see that part. I don't know if that was the case or if it was someone had just told her that this is something that could happen and to be aware of it and make sure you say that you didn't want that to happen to you.
So in 2021, I think that question needs to be addressed and documented.
Right.
Now we can kind of go from there to obstetric violence.
Right. And another thing, as I was researching and came across this story, I came across a few other kind of common threads of people that, you know, when it came to pelvic exams, I'm glad you mentioned having the chaperone in the room. That was one. Another couple people had said that the provider didn't wear gloves or had only one, which was just insane to me.
I don't know what to say.
Yeah. And then another thing was there were a lot of people who said that when they were getting their pelvic exam, the provider also did a rectal exam but didn't tell them that they were going to do that. And they just found out that this was happening as a finger was going into their rectum.
I mean, that provider should be reported.
Yeah. And this wasn't one. This was multiple people that had this experience.
I think it's important that a provider verbalize every action during that exam.
Right.
First of all, the patient, you know, you're lying on your back, staring
Yeah.
at the ceiling, and there's a drape in front of you,
Right.
and you don't know what's going on.
Right.
So I talk my patient through the
Yeah.
entire exam. I usually, the first thing I say is, here is my hand
Right.
as I touch the patient's leg,
Right.
let them know they are being touched.
Right.
And then I move forward. The rectal exam, for anyone under 50, I can't imagine a reason for rectal exam.
Yeah.
50 and up, we do a rectal exam to feel for any mass, hemorrhoid, as well as to see if there's any bleeding.
Right.
But I can't imagine that's being done. If that is being done, then that provider should be reported.
Right. Yeah.
That's not acceptable.
Yeah. I think the big thing is if you ever have an exam and something is done that makes you feel uncomfortable, knowing that, you know, you have the right to ask questions and to report and to say, you know, this didn't feel right.
Every state has board of medicine where there's a hotline and you can remain anonymous and report provider for various
reasons.
violations.